Poor circulation does not cause only the discomfort of having cold feet. It is a silent killer of your independence and triples your risk of falling after the age of 60. But what if I told you that a specific drink, which may be in your kitchen right now, is capable of reversing this damage and widening your arteries by up to 30% in a matter of hours, returning warmth and firmness to your legs? I am Dr. Grace Prescott, and in this video, I am going to rank the 10 most famous drinks for circulation from the worst to the best, separating what is junk from what really saves lives. You are going to understand exactly why your blood vessels shrink with age, and which is the only drink capable of flooding your system with nitric oxide, eliminating the feeling of heaviness and preventing silent microclots. Do you feel that constant tingling, or are you afraid to walk to the bathroom at night because you do not feel the floor properly? If you want to stop treating just the symptoms and recover your confidence when walking, stay with me until the end. What I am going to reveal contradicts what many doctors say, but it is the key to recovering your independence. So that you understand the seriousness of what is happening inside your legs right this moment, I need to paint a clear biological picture. When we pass 60 years of age, our body suffers a drastic drop in the production of a molecule called nitric oxide. We are talking about a reduction of about 70%. Nitric oxide is the maestro of your vascular health. It is the chemical signal that orders the walls of your arteries to relax, expand, and allow blood to flow freely like a mighty and unobstructed river. Without this molecule, your blood vessels become rigid, narrow, and fragile. It is like trying to pump water through a clogged coffee straw instead of a garden hose. Blood struggles to reach the extremities, and that is why your feet become icy, numb, and pale. But the real problem goes far beyond temperature. Without adequate blood flow, your nerves begin to starve from lack of oxygen, accelerating neuropathy. Worse still, stagnant blood is fertile ground for microclots that you do not see and do not feel, but they are there, undermining your health. Conventional medicine often suggests aspirin or compression stockings, but that is just managing the decline. We want to reverse the process. The good news is that this reversal does not require pharmaceutical miracles, but basic biochemistry. There are drinks that work like ignition keys for your vascular system, forcing the body to resume nitric oxide production through alternative pathways that do not depend on your age. When you consume these drinks, specific compounds are converted into potent vasodilators. The result is immediate vasodilation. Your arteries open, resistance decreases, and blood returns to nourish the deep tissues of your legs. I am talking about a flow increase of 40 to 60% that can be felt on the same day. However, the market is full of false promises. I spent months analyzing clinical studies and testing protocols to separate the wheat from the chaff. Let us rank now the 10 most mentioned drinks, starting with those that are a waste of time until we reach the holy grail of circulation. We start with drink number 10, plain water. It seems counterintuitive because everyone says to hydrate. Yes, dehydration makes blood viscous, like thick syrup, which hinders circulation. Drinking water is essential for life, but for pathological circulation in someone over 60 years old, water alone is like putting gasoline in a car with a broken engine. A study in the Journal of Applied Physiology showed that basic hydration improved blood flow by a miserable 8%. This is statistically irrelevant when you are fighting against a 70% loss in vascular function. Water does not contain the necessary chemical precursors to dilate arteries. It keeps you alive, but it does not solve the problem of cold legs. Drink your 8 glasses, but do not expect it to cure your neuropathy or improve your walking. It is the basic, not the treatment. In position number 9, we have green tea. It is adored by health gurus due to catechins, powerful antioxidants. But specifically for peripheral circulation in the legs, green tea falls short. Research indicates an improvement of about 12% in vascular dilation, which is better than water, but still very little for a quick clinical impact. The problem with green tea is slowness and inconsistency. You need to drink liters of it for months on end to see benefits in the endothelium, which is the inner layer of vessels. In addition, most people prepare it wrong, pouring boiling water over the leaves, which burns and destroys active compounds. And we cannot forget caffeine, which in some sensitive people causes temporary vasoconstriction, tightening the vessels we are trying to open. Is it healthy? Yes. Will it save your legs this week? No. Climbing to number 8, we find tart cherry juice. Here, science starts to get interesting. Anthocyanins present in these cherries help reduce artery stiffness, combating inflammation that hardens vessel walls. Studies showed an 18% improvement in blood flow after 3 months of use. But there is a big however that prevents me from strongly recommending it: sugar. 1 glass of this juice can contain 30 grams of sugar. For an elderly person, especially if there is prediabetes, this glucose spike generates an insulin spike that inflames vessels and cancels part of circulatory benefits. It is 1 step forward and 2 back. In addition, cost is prohibitive for many. If you like it, use it diluted, but know there are much more potent and safe options. Number 7 is pomegranate juice. This is a vascular protector. Pomegranate is rich in antioxidants called punicalagins. The mechanism here is different. Instead of just creating more nitric oxide, pomegranate protects the nitric oxide you already have, preventing it from being destroyed by free radicals. This increased blood flow by 22% in clinical tests. It is impressive, and in the long term, it even helps reduce plaque in arteries. However, we return to the sugar and cost problem. Pure pomegranate juice is even sweeter than cherry and extremely expensive. If you have budget and no glycemia problems, it is a good secondary addition, but it should not be your main strategy. Now, in position number 6, we have cocoa drink. Attention here. I am not talking about childish hot chocolate. I am talking about pure, bitter cocoa powder, rich in flavonols. Science on cocoa is robust. A meta-analysis of dozens of studies confirmed it improves blood flow by about 24%. And most importantly, the effect starts to be felt in 2 hours. Flavonols stimulate enzymatic nitric oxide production. The warmth sensation is real. The problem is palatability. Pure cocoa is bitter and earthy. If you add sugar or condensed milk, you destroy the therapeutic purpose. The best way is to mix with hot water or plant milk and sweeten with stevia. It is an excellent comfort drink that works if you can handle the strong taste. We enter the top 5 with watermelon juice. This fruit is one of nature's richest sources of L-citrulline. L-citrulline is an amino acid that your kidneys convert to L-arginine and subsequently to nitric oxide. It is a direct and effective route. 1 large glass can provide a therapeutic dose that improves arterial function by 28%. Patients report that leg pain decreases significantly after a week of daily consumption. Watermelon also helps lower systolic pressure. The only reason it is not at the top of the list is logistics. Getting fresh watermelon juice year-round is difficult and expensive out of season. In addition, the liquid volume needed for clinical dose is high, which can be inconvenient at night, but if it is in season, abuse it. At number 4, an underestimated gem, hibiscus tea. This is the best cost-benefit on the list. Hibiscus acts almost like a natural ACE inhibitor medication, relaxing blood vessels and potently reducing blood pressure. A 6-week study showed a 31% improvement in blood flow. It is fast, cheap, and easy to prepare. The taste is acidic, similar to cranberry, and very refreshing. Helping restore endothelial function is hibiscus' specialty. However, it is so potent in lowering blood pressure that if you already take hypertension medications, you need to monitor your pressure closely so it does not drop too much. Talk to your doctor, but do not ignore the power of this red flower. Now we reach the podium, where true magic happens. Number 3 is celery juice. For a long time, celery was seen only as fiber and water, but for circulation, it is a natural nitrate bomb. The process here is fascinating and starts in your mouth. Beneficial bacteria on your tongue convert celery nitrates to nitrites. When you swallow, stomach acid transforms these nitrites into gaseous nitric oxide that enters the bloodstream. 1 glass of celery juice can increase blood flow by up to 40% in a few hours. It is one of elite athletes' favorite strategies for muscle oxygenation, and it works wonderfully for elderly legs. The taste is polarizing, salty, and strong, and you need a juicer to extract liquid from fibers, but efficacy is undeniable. In runner-up position number 2 is arugula smoothie. If you want raw potency, arugula is the queen of green leaves. It contains more nitrates per gram than any other salad, far surpassing spinach and kale. 2 cups of arugula, blended with a little fruit to mask the spicy taste, create an elixir that can improve blood flow by 42% after just 2 weeks. The nitrate amount here is massive. People who adopt this smoothie report that leg skin changes color, losing that pale or bluish tone and gaining a healthy pink tone. Walking endurance increases drastically. It is not number 1 only because it requires daily preparation commitment and arugula spoils quickly in the fridge, requiring constant market trips. But in terms of power, it is almost unbeatable. And finally, number 1, the absolute king of circulation, beetroot juice. Nothing beats beetroot in consistency, ease, and proven results. 1 240 milliliter glass of pressed beetroot juice delivers a nitrate dose that your body converts to nitric oxide with brutal efficiency. We are talking about a blood flow increase of up to 50% within 3 hours after ingestion. But what makes beetroot unique is effect sustainability. Studies in the Journal of Applied Physiology showed that elderly people who drank this for 15 days increased their walking distance, reduced claudication pain, and decreased arterial stiffness by almost 40%. It is a complete physiological transformation. Your vessels rejuvenate. Blood reaches toes, nerves receive oxygen again, and fall risk plummets because your muscles are nourished. The ideal protocol I recommend to my patients is simple, but must be followed strictly. Start the day with beetroot juice. Drink on an empty stomach 30 minutes before breakfast. This is crucial for maximum nitrate absorption without interference from other proteins or fats. In the afternoon, you can complement with hibiscus tea to keep pressure controlled and vessels relaxed. If you want to vary, use arugula smoothie 3 times a week instead of beetroot. But beware of common mistakes that can ruin everything. Mistake number 1 is using antiseptic mouthwash. Remember I said tongue bacteria convert nitrates? If you use morning mouthwash, you kill these bacteria and turn off nitric oxide production mechanism. You will be drinking beetroot juice for nothing. Do not use mouthwash, or at least wait several hours after juice. Second mistake is taking antacids. You need stomach acid for second conversion stage. If you constantly neutralize your stomach, effect decreases. And of course, do not stop prescribed medications without medical order. These drinks are powerful, but must work together with your doctor's treatment, not against it. An important warning about beetroot. It can color your urine and feces red or pink. This is called beeturia. It is harmless and happens to about 15% of people, so do not panic thinking it is blood. In addition, if you have tendency to calcium oxalate kidney stones, beetroot should be consumed with caution or accompanied by plenty of water and calcium in meals. Talk to your nephrologist. But for the vast majority, it is safe and transformative. Science is clear. Your circulation decline is not a life sentence. It is a correctable nutritional deficiency. For decades, we ate processed foods poor in nitrates, and now your blood vessels are paying the price. By reintroducing these potent compounds, you are giving your body exactly the raw material it was begging for to fix internal roads of your circulatory system. So here is my challenge to you. Commit to the beetroot protocol for 30 days. Take a photo of your legs today. Observe color, swelling, varicose veins. In 1 month, take another photo. Visual difference is usually shocking, but sensation difference will be even greater. You will feel warmth returning, tingling disappearing, and most importantly, confidence in every step you take. Do not accept fragility as normal part of aging. Go to the market, buy your beets, and start recovering your life tomorrow morning. Your body knows how to heal, it just needs you to give the first sip.